This is my disease presentation, and this is my audience that will also be recording me. Respiratory syncytial virus, also known as RSV. RSV was discovered in 1956 and is a member of the family Paramyxoviridae and the subfamily Pneumovirinae. There is a type A and a type B, although there is no clear significance of either type of the virus. Populations that are most at risk are premature infants, infants that are younger than 60 days old, children who have lung or heart disease and the immunocompromised, as well as adults over the age of 65. It begins in the epithelial cells of the nasopharynx, and it spreads through the movement of mucus with the ciliated membranes. It moves to the bronchiolar epithelium. The bronchioles are the smallest part of the airway, and they are located in the lower lungs. It will settle in your lower respiratory tract with symptoms beginning within 1 to 3 days after initial exposure, and you are contagious from the moment you're contaminated. During the peak seasons, usually November through March, RSV spreads quickly through crowded places such as daycare, schools, nursing homes, anywhere that is very publicly occupied. Keeping young infants home and out of highly occupied public spaces is recommended during the winter season. Staying home or keeping children home if they are showing any symptoms or signs of being sick can help to limit the spread of the RSV virus. Even though the virus is unavoidable due to being contagious before it's detected, staying home while sick can prevent further spread of RSV. You are most contagious for a few days after contamination, but you may still spread the virus for a few weeks after you start the infection. RSV will begin as normal cold symptoms in infants, which will be rhinorrhea, which is runny nose, a dry cough, wheezing, fever, sore throat, mild headaches, lethargy, and poor eating. Respiratory rates that are greater than 60 breaths per minute while the child is at rest should be a cause for concern. Also, apnea can occur in severe cases and medical attention should be sought. It can be very dangerous in young infants, especially those born prematurely or infants that have heart or lung conditions. It can also be serious in adults that are over 65. RSV is viral, it's not bacterial, therefore antibiotics are not a part of the therapeutic plan unless there's a concurrent bacterial infection such as a urinary tract infection or otitis media. RSV is so common that most children have been infected by the virus by the time they are 2 years old. In adults and in older children, the symptoms are so mild they typically mimic the common cold, and you would just treat the symptoms for that. In severe cases, it can cause pneumonia or bronchiolitis with symptoms that would include wheezing, rapid breathing, and cyanosis, which is the bluing of the lips, fingers, and toenails due to the lack of oxygen in the blood. According to the CDC and the Mayo Clinic in 2014, close to 3 million children and 177,000 adults will be hospitalized with RSV-related viral illnesses. Most of the inpatient visits are going to be those of children from the ages of 2 to 6 months old. There are estimated to be about 2.1 million outpatient visits for children younger than 5, with the death rate being about 42. And in adults older than 65, we do not have any data available for outpatient visits, but there are approximately 14,000 deaths linked to RSV. Observation of symptoms, as well as any knowledge of key outbreaks in the region, will be a diagnostic tool that physicians can use to diagnose RSV. It can also be diagnosed through antigen detection assays, Detection of viral RNA from nasal swabs or through the suctioning of the nasal cavity, which is called a nasal wash, where they will then test the mucus for the RSV virus. Also, blood tests that measure serum antibodies and x-rays will be used as diagnostic tools. Both urinary tract infections and otitis media, which is a common ear infection, are common concurrent infections to RSV and should be treated along with the virus. They will be treated with antibiotics, but that will not help treat the RSV virus itself. Supportive treatments for RSV are what is recommended, and they include intravenous fluids, analgesics, which are fever reducers, and nasal suctioning. Bronchodilators can be used in children and infants who are wheezing, but should only be continued if the child is showing a positive response to the treatment itself. And corticosteroids should only be used in a child who's been diagnosed with asthma. Children who have been hospitalized for RSV should be administered fluids intravenously to prevent dehydration. Oxygen saturation should be maintained and monitored to above 90%. They should also be monitored for sepsis, which is a life-threatening complication of an infection that may cause death. While there are no vaccines to prevent RSV, there is a prophylactic drug available mainly to high-risk infants called palivizumab, and it's also known by its brand name Synagis. It will be administered intramuscularly to children who are high risk once a month during the RSV season. RSV is spread by nasal secretions and droplets from the mouth. It can be spread by coughing or sneezing into your hands and touching any surfaces, by shaking hands, by kissing people, by sharing utensils, food. Hand washing with soap, using hand sanitizers and disinfectants are good measures to use when preventing RSV. It can live on surfaces for more than 6 hours, such as countertop surfaces such as doorknobs, light switches, any non-porous place, etc. RSV can also live on your skin, your clothing, and tissue paper for approximately 30 minutes after contact. Hospital personnel who treat patients with RSV should take precautions and wear gloves, masks, and gowns when entering a room that is RSV positive to further prevent the spread of the RSV virus.